ممكن السلايدز الدكتور احمد طرابلسي يا جماعه، مش وفاء. سلايدز الدكتور احمد طرابلسي هو اللي هيبتدي الاول، مش السلايدز دي.
مساء الخير
نو هو اللي هيبتدي.
واهلا وسهلا بيكم. وتلاحظوا ان انا بتكلم مصري كويس، واحب اشكر زميلي وصديقي الاستاذ الدكتور محمد شفيق، وطبعا كل الزملاء المصريين انا متعود اشوفهم كل مره، افرح بان انا اقابلهم، وانا فخور ان انا اكون في اسكندريه المره دي. I left my heart in Alexandria before. النهارده I will try to be brief. هجيب لكم عن التجربه بتاعه نادي البصر اللي هو فيرست سلايد. في الصورة اللي قدامكم in the middle is Professor Rida Mabrouk, the founder of Nadi Al-Basar, and on your left hand side the President Bourguiba, the president of the country, and your right hand side is Professor Abdel Salam, the Nobel Prize winner, who actually kindly became our honorary president. So the aim of Nadi Al-Basar, or our goals, is to prevent blindness through human resources development, cataract surgery, and services delivery, and community awareness, and lastly, low vision aid. This one. So I'm going to tell you about the history of low vision in Tunisia. In 1982 or 84, I was learning ophthalmology in London, and I was impressed by the low vision services they are giving to the patients. So as you see, the children are the most precious resources in the family, and they represent the family's future and hopes. In our Ministry of Health, the population of blind people is 40,000. 160,000 are visually impaired with different ages. So as you know, a child who's blind could be, the blindness in children can be prevented or cured, or even greater disaster if you don't have a child to have the chance to be cured. So the economic cost of blindness is huge. It costs millions and millions of dollars. So Nadi Al-Basar actually is a non-governmental organization coordinated with the public sector, university sector, and the private sector. On the left-hand side, this image go back to 1982, where Silver Janet from London came to Tunis to build our nucleus of low vision in Tunisia. On the right-hand side, I met with Sam Janinsky in Santa Monica. He was actually partially sighted and has his institute for low vision. Nadi Al-Basar actually is about 30 years of experience. We have regular free consultations. The team consists of ophthalmologists, re-educator, orthoptist. And I would like to highlight the role of the orthoptist, which is very, very important in low vision. We have orthogenetic advices, early diagnosis, early treatment, and rehabilitation. So the major objective of our project is to prevent, treat, and control curable blindness in children. The pathology in ophthalmology in childhood have changed from time to time. Now we are leaving behind the infectious diseases and the corneal diseases, and now are facing the refractive errors, nystagmus, cataract, and strabismus. I would like to introduce, this is the old building of the Clinique Ophthalmologique de Tunis, which is ideal to have situated, having a low vision unit in it, because you have everything available in this, appropriate equipment, operating rooms, eye bank, lasers, cryo, etc. So in this place, actually, all the subspecialties exist, which can give the low vision child or person a very good opportunity to be surrounded by medical care. These are some examples of the children who are having rehabilitation revision, but I would like to highlight the role of the orthoptist. Actually, she's the best one to do rehabilitation, and she's actually experienced with that. So this is some photos of the facilities we have, like electrophysiology and others. This image go back to the International Agency for Prevention of Blindness, where we became a member of the Committee of Low Vision with different people from Australia, America, and others. I would like to highlight the Low Vision Task Force, which was established in Italy by Avvocato Castronovo, who was actually a blind, and he supported to have this North African Italian IPB, of course, with Professor Lamperuso and other members. So this photo collects North African ophthalmologists and Italian ophthalmologists, and we try to make a low vision session in every society in North Africa meeting. And this one, the Mediterranean Congress of Ophthalmology, Afro-Asian Congress for Algerian Society, all these are examples that low vision is becoming serious. I would like to show Dr. Filippo in this image. He was from the first people who was with us. Recently, Professor Lambruso established an exercises book in Arabic language, and it was the first time to have an Arabic language exercises book for low vision. And this is an example of the meetings of other people who met in Tunisia in several occasions. In conclusion, Nadia Al-Basar has 30 years of experience in prevention, genetic, early diagnosis and early treatment, rehabilitation, reduced handicap consequences. This is a curse seat for Dr. Nihal Shaknaqiri in her unit, which I'm hoping and praying that one day we'll have a low vision aid in Alexandria. Thank you.
And now I would love to introduce Professor Filippo Amore. I would like to thank him sincerely for his visit to our department in Alexandria and to give this lecture in his words, hoping that one day we can build and construct a new center for low vision aid for those needy patients, and to introduce a new subspecialty that we are lagging this kind of experience. Professor Filippo Amori is a professor of ophthalmology and a director of the Italian National Center of Prevention of Blindness and Rehabilitation of Vision. This center is a collaborating center with the WHO, and he's also a professor of university in the Catholic University of Rome and the Gemelli University Hospitals, which is the hospital of the Pope, of the Catholic Pope. He is a president of the European Society of Low Vision Research and Vision Rehabilitation. We're really very glad that he take this task to come to Alexandria to teach us his experience, a worldwide experience and a European one in the field of the low vision and visual rehabilitation. And we're really looking forward for his help to extend the knowledge to our department and our country. Thank you very much, Professor Filippo Amori, for accepting our invitation.